Well, hello everyone, and welcome to this conversation on brain health. What an evening we have planned for you. My name is Leslie Fontenot, and I'm the Managing Director for Black Health Matters. Black Health Matters was launched in 2012, and it's really the leading health, wellness, and chronic disease platform whose mission is to improve health literacy, which includes addressing healthcare, health policy, health equity, and disparities for better outcomes among African Americans. We know that statistics around health in the Black community can be alarming, but we also know there is an opportunity for hope and positivity. That's what tonight is really all about. You know, we cannot really have health equity without brain health equity. So our goal tonight is to provide a message of hope and to also focus on fighting stigma, providing empowerment, and taking action. Because every person, each and every one of you, can take steps to keep your brain healthy and reduce the risk of Alzheimer's disease. We'll learn how organizations, communities, families, and individuals can join the movement for brain health equity. And we'll do that right now, starting with our agenda. So our agenda features remarks from former Surgeon General Dr. David Satcher. We'll have a panel discussion on brain health strategies, and we'll also leave you with resources that are available right here in Atlanta, Georgia. We'll close with an open Q&A. So at this time, I'd like to thank our sponsor, ASI, for their support, and our lead program partners who helped put this all together this evening. So first off, you know, BrainGuide. BrainGuide is by Us Against Alzheimer's. And BrainGuide is a tool, a resource that you can use. It's a first of its kind platform that empowers people with knowledge and resources to take the next steps in managing their own or a loved one's brain health. It's simple and easy to use, and there's even a phone number for you as well if you're digitally challenged. Alter is another organization we partnered with, which seeks to address the lack of resources and awareness around dementia in African American and faith-based communities here in Georgia. Emory University's Goizueta Alzheimer's Disease Research Center is another partner we have tonight. And the center is an NIH-supported research center to improve the lives of individuals affected by Alzheimer's through innovative research. Of course, we have Black Health Matters, and our community partners, last but not least, for supporting this webinar are also our co-hosts. We have Kappa Alpha Sorority Incorporated. We have Georgia Memory Net, Omega Psi-Phi Fraternity Incorporated, and SageNavigator. So let's get started. At this time, I'm thrilled to introduce our first speaker, Dr. David Satcher. So Dr. Satcher is the founding director and senior advisor of the Satcher Health Leadership Institute, and he's also a professor at Morehouse School of Medicine. Most of you know he previously served as Surgeon General during the Clinton and Bush administrations, as well as Assistant Secretary of Health and Director of the CDC. Dr. Satcher provided these thoughts for us on the role of brain health for the Black community. So please listen in.
Greetings, and thank you all for attending this important session. You know, just by tuning in, you're joining one of the most vital conversations for Black communities today, that is brain health. And like any conversation, that first word, that first step is the most crucial. For too long, stigma, fear, and misunderstanding have prevented people from taking that first step. There's often been the misconception that nothing can be done about Alzheimer's and dementia. But the available scientific evidence tells a different story. In fact, a recent global review of research finds that as many as 40% of cases of dementia can be prevented by acting on modifiable risk factors. And research also finds important benefits for early detection and diagnosis, such as access to support, clinical trials, and care planning. So how can we just put that knowledge into action for Black lives and Black communities? How can we achieve brain health equity? I believe that 3 points are key. First, we must spread a message of hope and empowerment. We know that every person can reduce their risk by eating well, exercising, cutting out tobacco, and cutting out alcohol, but also controlling comorbid conditions like diabetes, obesity, hypertension, and depression. But we also know what works in one community may not work in another. We can't assume that everyone has a safe place to exercise, for example, or an affordable source of fresh food, or easy access to healthcare. Everyone can take that all-important first step, but it will work different for each person who takes it. So we need to make sure that brain health guidance is positive, clear, and actionable. New tools like BrainGuide can help everyone to take that first step. BrainGuide is a first of its kind platform that enables people to take a memory questionnaire and then see tailored brain health information. It can help people start their journey with confidence, no matter where they are in that journey. And I believe it can be a tremendous resource for Black families who want to reduce their risk, navigate caregiving, or prepare for a doctor's visit. That brings me to the second point. Brain health happens at the local level. Community groups and leaders know what will work for their members, their constituents, and neighbors. These existing networks already have the reach, the knowledge, and most importantly, they have the trust that is so critical to public health. We just need to add brain health to that list. Black communities are already taking the lead in wonderfully resourceful and creative ways. Church groups are sharing the brain healthy recipes. Local senior citizens are hosting memory screening, and pastors and mayors, nurses and physicians are stepping up as trusted messengers for their family, friends, and neighbors. Finally, we must all work together as one team, the Alzheimer's community and Black communities. This is the only way that we'll achieve brain health equity. The best scientists in the world are working to advance the understanding of the disease and push toward new breakthroughs. But that expert knowledge is only useful if people can put it into practice. Black communities, networks, and leaders can spread the knowledge we already have, starting today. This will also pave the way to act on new advances as they become available. We can also call on physicians to treat all patients equitably. The history of racial bias in healthcare, in the healthcare system, together with the stigma of dementia, can be a major deterrent to seeking care. So physicians and nurses should be educated for culturally competent care, especially for difficult conversations about dementia. This is vital for improving Black patient access to early diagnosis, clinical trial options, high quality care. As we strive to promote brain health in Black communities, we can also advance better memory care in the health system that serves those communities. But ultimately, brain health equity requires that we care enough, that we know enough, we're willing to do enough, and that we will persevere until the job is done. So please join me in this brain health movement, where if we work together as one team, we can be brain health heroes for ourselves, our families, and our neighbors, but also for our colleagues and friends. So I hope today's session will help all of us to make progress on that journey. Thank you.
Well, thank you to Dr. Satcher for sharing your experience with us. We're honored to have your support both within this community conversation and, of course, as a dedicated board member to Us Against Alzheimer's, where I'm joining you all from tonight. Well, my name is Stephanie Monroe, and I'm Executive Director of African Americans Against Alzheimer's, which is the nation's first organization dedicated to a coordinated national response to Alzheimer's disease among African Americans. I have the pleasure of moderating this important conversation about brain health in the Black community. Well, before we launch into the conversation, let's get everyone on the same page. Us Against Alzheimer's is committed to brain health equity, and our aim is to bring resources to the Black community through our network and partners. Here in Atlanta, we're working with our partners to raise awareness about brain health in the community and the importance of early detection and diagnosis. So what is Alzheimer's disease? Alzheimer's disease is basically a neurological disease that impacts our memory and thinking and our ability to carry out basic tasks. Left unchecked, Alzheimer's disease will impact an ability of individuals to process and participate in activities of daily living, like food and nutrition, like general memory, like being able to walk with a certain gait, being able to swallow. A lot of things that we don't typically think of when we think about Alzheimer's disease, but they are certainly controlled by this beautiful engine, which is our brain. And I think that's important for us to think about. Every organism, everything that happens in our body, every system, whether it's the heart, the ability of our body to produce insulin, all of these are controlled by the brain. And so when there is an issue with the brain, even though it may happen over time, it can affect our body's natural ability to regulate itself. Alzheimer's disease is a progressive disease, meaning that it will continue to develop and change over time. It does slowly destroy memory and thinking skills. The encouraging thing, though, is that brain changes can begin sometimes up to 20 years before any noticeable symptoms. This means there's a large opportunity for people to intervene and for medicines to possibly be developed to identify those brain changes before people have symptoms. Of all the different types of dementia, and we get this question a lot, Alzheimer's disease is 75 or 60 to 80% of all types of dementia. Other types of dementia may include frontal temporal, Lewy bodies, vascular dementia, mixed forms of dementia, et cetera. But 75% on basically is an Alzheimer's type dementia. And that is important because treatments are being designed for different types of dementia based on the different types of systems that they present. And that's why early diagnosis and understanding of what these brain changes are, what they're being caused by, which we'll talk to our panelists a little bit later, and why that's so important. On the issue of statistics, it's important for us to know that African Americans are 2 to 3 times more likely to develop Alzheimer's disease than non-Hispanic white Americans. And Latino Americans are at least 1.5 times as likely. We don't quite understand all of the reasons for this. And that's why more research that involves these communities is essential to us understanding why are we seeing these types of disparities. And these disparities impact not just the number of people, but the cost of Alzheimer's disease on families. We found that family and caregiver costs for persons with Alzheimer's left untreated and with a late diagnosis can be up to $10,000 a month. we found that individuals having to leave their jobs to take care of a loved one with Alzheimer's disease, again, once symptoms begin, can be very disruptive to families, although many families, especially Black Americans, want to do that. We want to keep our families at home as much as we can. By 2030, as America ages and browns, we know that nearly 40% of all Americans will be Black or Latino. Think about that, 40%. And these are just some of the sobering statistics concerning the health disparities facing Black communities. Alzheimer's disease is at the top of the list. Encouragingly, though, there are treatments and there are strategies that early detection and diagnosis, that our early intervention in terms of good pro-health, healthy aging, things that are good for our heart are also good for our brain. And so being able to understand what those are, taking personal responsibility to implement those, we believe will have a really strong impact on individuals being able to age well and hopefully avoid Alzheimer's disease. So when we think about a cancer diagnosis, for example, we think about wanting to find it at an early age, at an early stage. And this needs to be the same for people who have Alzheimer's disease. Unfortunately, stigma and fear has really tripped us up, and we don't want to talk about it. We're ashamed about it. We think that person's just crazy. And so things go on in that family, and we're not aware of it as friends, as family, as pastors, until sometimes it's so far down that the medicines that could work most effectively won't be able to work most effectively. So tonight we're going to change that. We're going to begin this important conversation. We're going to welcome you to ask your questions. We hope we cover the materials that you're interested in. And we're going to connect you to important resources such as the BrainGuide, which will give you a good look into sort of how you're doing, what does normal aging look like, and how are you on your trajectory to that. So why are we here? What do we hope to accomplish? We want to look at and increase the awareness and the knowledge in the Black community about brain health and the importance of early detection and diagnosis. We want to have a candid conversation about how we can keep our brains healthy. And we want to share the resources that I just described, including the BrainGuide. So before we go into the panel discussion, I want to share with you more about this resource that is available to all of you. We introduced it in opening credits. I've actually taken advantage of it myself. We've recently launched this platform called BrainGuide. It's a free service that includes confidential memory questionnaires that you can take for yourself or for a loved one that you see often. Based on your answers that you provide, you'll be given tailored information and ideas on the next steps that you can take. We know that taking the first steps in addressing brain health and memory concerns can be tough. BrainGuide makes this a simple task. It allows you to visit mybrainguide.org or to call the number 1-855-272-4641 and go through the private questionnaire. It's really easy. We've had to date more than 170,000 people participate already. And our two panelists this evening have provided really important advice and guidance on its development. Now, hopefully, if you're driving around or if you're stuck in traffic in Atlanta, you've been able to see some of the promotion signs that we've posted through billboards of these resources, as well as ads that have been placed on buses and more. We're fortunate to have had great partnerships throughout the creation of BrainGuide, and the platform was built on Amazon Web Services technology with in-kind and financial support from Biogen. So with that, let's dig into the conversation. It's my great pleasure to introduce to you today Dr. Favron Epps and Dr. Monica Parker. Dr. Epps is assistant professor at the Nell Hodgkin School of Nursing at Emory University and founder of the ALTER program, a dementia-friendly program for Black churches. Next, Dr. Monica Parker is a licensed practicing physician and an assistant professor of neurology at Emory University. I've had the pleasure of working with these two ladies before, and I'm excited at this moment to be able to begin this conversation. So with that, if we're ready to delve in, let me start with Dr. Parker. So Dr. Parker, can you share with our listeners what it means to be brain healthy, and talk about the steps we can all take to maintain brain health? We often hear about, memory loss being normal. And a lot of people don't understand, first of all, what the difference is between memory loss and a cognitive concern that we should begin to look at and explore. So can you get us into this conversation, try to even what we're looking at here?
Thanks, Stephanie. Happy to do so. One of the things, and Dr. Satcher kind of alluded to it, and he kind of started us off with it. He talked about overall health, how important it is to stay healthy. And he talked about research that's going on that shows that managing your person, staying healthy, keeps you from developing certain things. So when we start talking about Alzheimer's and memory loss and other things, when somebody starts repeating stories, when somebody starts forgetting things, we're already too late, okay? Most people who develop problems with their memory generally have other problems. Here in Georgia, we know that more than 50% of the people who have Medicare and have been diagnosed with Alzheimer's or related dementia have at least 4 chronic diseases. Those chronic diseases include hypertension, they include diabetes, they include high cholesterol, and heart disease. Now, what's the importance of all of those things? Well, in communities of color, those diseases are not well controlled and are not well managed, and they may predispose us to developing a dementia. Most commonly, we think of vascular disease or strokes, okay? We understand strokes, or we think we understand strokes. But what science is teasing out and teaching us now is that cardiovascular disease, those strokes, can precipitate what we call the Alzheimer's cascade. There are a number of things that go on with this. So when we start talking about brain health, we have to stay physically healthy. We have to prevent hypertension. And if we're discovered or found to have hypertension or diabetes or high cholesterol, we need to manage that, because failure to manage that makes it more likely that you will develop cognitive impairment. That's problems with your memory, okay? May lead to some memory loss. So brain health is directly related to your overall physical health. And so how do we as a community maintain that? I'm a primary care doctor, so our purpose is to help you manage chronic diseases, but more importantly, help you prevent disease. So one of the things that we all need to do, particularly if we're over the age of 65, is make sure we do all of our preventive screening. At age 65, you're supposed to get a cholesterol check. You're supposed to get an EKG. You're supposed to get a glucose check if you've never had one before. But more importantly, as part of that annual wellness exam, we do a memory screen and we do a depression screen. Now, why do you want to get them at 65? Because we know that that's when most people start to slow down and may start to develop these things. As you pointed out, Alzheimer's pathology is present in the brain for about 20 years before most people get a diagnosis. Mm-hmm. So maintaining your overall health helps protect your brain.
So, Dr. Parker, what happens if your doctor doesn't raise these issues with you? You turn 65, you go in, he spends 15 minutes and he's not doing these screenings. What does the patient do? What are our options?
Find another doctor. I think that one of the things that we need to do, and I think in our community, we have been a little bit more willing to wait upon what the doctor says do. And in our communities, we almost always do, most of the time, what the doctor tells us to do. And if the doctor says, I don't need to do this, we won't do that. But because of the Affordable Care Act, we have now learned that there are a lot of preventive studies, or I shouldn't say studies, I should say tests that all Americans are entitled to, depending upon what your age is, whatever it is. They cost you nothing additional outside of what your insurance would pay for. So educate yourself. Find out about wellness exams for your particular age group. For those of us who are 65 years of age and older and getting into Medicare, look at the website for Medicare and understand what preventive health guidelines are. In this day and age, we can't afford to be ignorant about what good health is and what's available to us and wait for somebody to tell us what to do. You've got Google.
Absolutely.
We need to look that stuff up. So
Absolutely.
annual wellness visits are things that we can do.
And in fact, that my father has Alzheimer's disease, and that's exactly what we had to do when the doctor asked me, why would you want to know when it came time to screening my dad? And I said, well, if I had a lump on my breast, would you ask me why I'd want to know, why I would want to get a biopsy? Because it empowers me to make decisions. It empowers our family with knowledge so that we can plan for the future. So I absolutely love that individuals, it's okay, it's not insulting, but in order to protect your health and the health of your loved ones, sometimes you're going to have to be that person that stands up and says, cuz, or I'm going to have to move somewhere else. Right. So that was a great answer. Dr. Epps, I know that you do a lot of work in communities, particularly through our churches. Many churches are really learning now about Alzheimer's disease and having conversations about so many health issues that face the Black community. How do we bring those conversations to bear where, in church, which is like a safe place, right? I remember again with my dad, once he was called out for what someone thought was he was just behaving weirdly. And my mom felt so ashamed that he had been called out for his behavior. They stopped going for the longest time. So how do we educate people in church? Because the worst thing you can do, right, with many of these challenges, to go into social isolation. You need to be in a supportive environment with your family, with church members, but they need to be dementia friendly. They need to know how to welcome people in so that they can have those connections that are so important. Can you speak to that a little bit?
Yes, I can. And thanks, Stephanie, for that question. I think just like you said, and we've been talking about, is education. And I think that's the beginning, is to be able to educate. And if we're going into the trusted communities, and the church being one of them, I start off with educating the senior leaders, the pastors, the clergy, because they have to have a full understanding, and then also educating the congregation, then the community that they serve. So it's tiered. And we've had success doing that. But, if you try to do it the other way and just educate the community, it's just there. But you have to get to the leader so then they can help spread the message on a pulpit. And then, when we offer these open education events, just like the one we're doing tonight, then everyone can join, because just like Dr. Satcher said, our pastors, they're trusted leaders in the community. And if we get them to understand what is going on, not only in the community, but what's going on in their church, and get them on board, then that allows everyone to say, oh, okay. And I've had caregivers that reach out to me and they say, my bishop started talking about dementia at church. And so I felt comfortable calling him and telling him what I was going through. And that shows how important that is for leaders, and not just our faith leaders, but all leaders in the community, to be educated on the conditions and the diseases, the illnesses that are impacting the Black community.
Right, giving people permission to talk about it. And I would guess also that the pastors themselves who are aging may be experiencing some of these changes. Like, who do they go to talk to, right? Because of that very issue.
Exactly.
Right.
And so, and then them having that comfort level when, then they look to me and Dr. Parker, they look to us as those trusted resources, because themselves, may be experiencing some things. And so we promote that BrainGuide. I promote it hard. I keep it on my phone when I'm out because, you know, we talked about the stigma that's associated with it. That's real. That is real. And
Right.
even though we do this education, it does not happen overnight for people to feel comfortable. It takes time. And so many times people come to me after service, after a community event, and they want to pull me aside. And then they whispering. So they done pull me to the side, plus they whispering, I think I have some issues, you know, and at that moment, I have the BrainGuide or I have the resources for them. And that just shows that people are experiencing, they have concerns. They're experiencing some of the signs and symptoms that you mentioned. And we just need to be there to let them know it's okay to talk about it. And provide the resources for them.
Absolutely. So let's talk about, I guess, some of the reasons why people might have difficulty. I mean, I think one of the beautiful things about BrainGuide is that it doesn't discriminate. You don't have to worry about the ways of looking at you or whether someone else got treated first in the waiting room, how much time they took. You know, some of these things that Black people that we face, feeling that we're being treated differently, that we're maybe not treated as seriously, but it seems like it would be something that would be really empowering to get this almost like a record of how well you're doing that you can then take to the physician. What was really important to you guys in terms of how you viewed it as the experts that we turn to in terms of developing this consumer tool that we hope will be useful to people both in their homes, but also that they could use it to validate what they were experiencing when they went to a physician who may not necessarily believe them?
I think it's the anonymity and the comfort in which you do this. I don't really want to say in secret, but in private, in the comfort of your own home and where you feel comfortable. And then as a result of using the tool, there are things that you might have thought about. And as a result of learning this, you've learned a little bit more. So you're more likely to raise the topic with your provider or ask. One of the things as a clinician that I've found, it can be annoying sometimes, but it's really good. You kind of like it when patients come to you with something that they've read, an article that says, well, what about this? Do I have this? What do you think about this? I think that's a good thing. So I think BrainGuide makes it possible for you to ask questions and learn on your own in a place where you feel comfortable.
And to add to that, when it was in the development and I was reviewing it, one of the things I looked out for was the ease of taking it in the privacy of your home. Because remember, you're not around any healthcare professionals. You can take it in a room by yourself and go in the closet if you choose to take it. And so I was really paying attention to the ease and the ease at all ages, because there's not a certain age to check your memory. So I was concerned about how if you have the young adults that were taking it all the way up to those that are in 80s and 90s, what is the ease? And I have to say, you know, I gave feedback. So people that know me, I gave feedback, but I am very comfortable to say that it is very easy to use. And having the phone number for those that do not want to go on their smartphone or laptop makes it helpful. And I just want to share this note. You know, we tell people to Google stuff and to type stuff. And I just want to make sure that we use Siri to its fullest capability. And so, because some people, I'm not typing that in. Well, then if you have an iPhone, ask Siri to go to my BrainGuide. I just want to make sure I put that out there. Yeah, that's the shortcut. That's what my mom does. I tell her to type things in and she was like, I'm not typing that. Siri, go to, and so I just want to make sure.
I didn't even know Siri could be used like that, but Siri's like sometimes listening to me and responding to things I've said. It's like, I wasn't talking to you, Siri, but Siri will volunteer information, which is great for that. So I enjoyed, I did this because of my dad, and also because, I'm concerned myself, I'm at a certain age and I want to make sure that, just because I forgot where my keys are, or I came in my room and couldn't find my ring light or whatever, that I was able to find it. It wasn't lost from my memory. It was just temporarily misplaced in my mind, but I was able to find that. And so that's great. Tell us, I know a lot of us are talking about, the things that we can do. And the more we learn about dementia and cognitive impairments and just really aging well, it seems like science is really pointing to the fact that there are things that we can do early on in terms of habits that we should begin to adopt that will really help us. And I wanted to ask Dr. Epps, after Monica talks a little bit about what those efforts are, what does that have to do with the fried chicken dinner that's going to happen at church? Like, how is that going to be modified to help with some of these strategies that we know are going to be really important that we can do on our own? So Monica, can you talk a little bit about those strategies that are important?
In 2017, the Lancet Commission looked at least 9 different things that we could look at to prevent or make it less likely that we could get dementia. So at the top of the list was managing chronic diseases that we've discussed before, but other things that you might not have thought about. Maintaining social engagement, socializing, getting involved in things, keeping your mind and your brain active, exercising on a regular basis. In geriatrics, we say at least 150 minutes a week. In my sorority and in other groups that I'm in, we're on the walking 10,000 step challenge, staying physically active. You alluded to the fried chicken. Air fried wings are pretty good, but things that you can do, Mediterranean diet. And I hate to say Mediterranean diet all the time because that puts it in a European marketplace, but it's sort of like, okay, let's have fish. But in my house, my husband wants fried crappie. He doesn't want baked salmon. He doesn't want something else. So less fried food and more braised, broiled, baked things, more fruits and vegetables. In addition to exercise and eating a little bit differently, one of the things that the Lancet Commission recommended that we do that is available to all of us is check our hearing. Okay. When's the last time you got your hearing checked? Okay. Your hearing is next to your brain. If you can't interpret the world, that kind of gives you bad things to do. So managing hearing loss. Okay. Screening for and managing depression. Yes. But social isolation we can get, managing sleep, eating better, exercise. Those are all things that we can do. And of course, as Dr. Satcher said at the beginning, stop smoking, not drinking to excess, those kinds of things. Those are things that we can all do.
Yeah.
Manage our chronic illness, exercise, eat better, stay socially engaged.
Wow, that's really helpful at any age. So many of us have been hearing about, new Alzheimer's treatments that are in the pipeline, one that has been approved for use, and albeit with some challenges. We know that it's taking a long time to develop effective treatments in this Alzheimer's space. So why is it important for Black communities, while we wait for those drugs to be approved for safety and efficacy and to make sure they work in our communities? Why is it important for Black communities to start talking about brain health now?
Because you talked about early detection. Yeah, there's a process right now for early detection. But if we're paying attention, there are also diagnostic tools that are available, maybe not commercially, but through research. One of those is the amyloid PET scan. That's the only FDA approved radiologic exam that basically proves that you have Alzheimer's. Okay. And you can look at that and it shows up even before you have symptoms. You get that through research. You're not going to go march down the street and knock on anybody's door and bang it down to get that. That comes through research. Yeah. But that's why research participation is important. 10 years ago, when I started in this research and working on this, we were working with older people who had well-engaged Alzheimer's and related dementias. Well, as research progressed, they've learned that dealing with the disease at that end makes it less likely that you're going to find a definitive cure or treatment. So right now, research is focused on what are we doing to stay healthy? What are the very early signs at which we can diagnose this disease? Now, when I say early, some people say, okay, memory loss is an early sign. So in Alzheimer's nomenclature, early means before age 65. Now, why do you want to know if you have a family history of somebody who has definitive Alzheimer's, and not just dementia, but definitive Alzheimer's? Early onset Alzheimer's is what occurs before age 65. Well, if you're an active working person and you have a diagnosis of Alzheimer's, rather than be fired from your job for poor performance, you can retire and get a medical disability. That's why it's important. Okay. As these drugs are developing, the aducanumab is for people who are in the very, very early stages of Alzheimer's. That's been confirmed by cerebrospinal fluid or by this amyloid PET scan. If you don't have the diagnosis, you can't really get aducanumab. So that medication is not going to be for you. That medication is not for my 95-year-old mother who also has definitive Alzheimer's. It's not for her. It would be for me if I have that found in my brain. So I'm looking at trying to get a PET scan.
Yeah. And it's interesting too, because, so often, when we think about, the luxury of being able to go to a store and pick a medicine off the shelf, we don't think about what went into. There were people who volunteered to test that medicine to make sure it worked well and it was safe and it worked effectively for them, and other conditions that they had weren't interfering with that. I was really so surprised to find out that in terms of clinical research defining medications, that Blacks and Latinos are sometimes less than 5% of the people who are being tested. So like 93% of people that we manufacture drugs is based on a bunch of people who don't look like me. What do we say to people about how important it is, while we're looking for new treatments, that we be part of the solution?
I think that is a really good question. And that's really why I've kind of had a career direction change, because one of the things that I did observe was that there were African Americans who were similar to the Europeans in age and income and educational level. We weren't in research studies, they were. But it's not that we don't want to participate. We haven't necessarily known about the opportunity to do so. Yeah. So referring people to things like clinicaltrials.gov, okay, that's some work, but it makes more sense to be directly associated with an entity that's providing some of that research. Us Against Alzheimer's lets you know where these things are, where there are research centers. And, as a clinician, I personally like being associated with an academic medical center because that allows me to stay on top of things.
Yeah.
But that is more likely the place where clinical research is going on, whether it's for Alzheimer's, for cancer, or something else. And all of the primary care doctors may not be aware of these opportunities. That's why you kind of have to do a lot of little put your own elbow grease in there, because they're not omnipotent. We don't know everything. Some people would like to say they do, but we don't know everything. But find a research center where they're doing studies for the disease entity that you're interested in.
Fantastic.
I would like to add, Stephanie, be nosy. It is okay to see what's going on over there.
Yeah. Find
out more information, because it's really key for us to participate. And do not think all research studies have a needle is involved. There's a lot of clinical trials that have different things and opportunities that you can participate in and contribute to your community, contribute to your grandson, your granddaughter, their lives. And so I tell people to be nosy, to find out what's going on. And I also want to share, I want to put a challenge out here as we wrap up to the Black community. My challenge is, let's reverse these alarming statistics. So when you know better, you do better.
Mhm.
So after all of this information that we're sharing, Dr. Parker shared, you share, Dr. Satcher, I'm challenging the community to now, okay, let's take this information. Holidays are coming up, families are coming together. Let's have these conversations. And I know we're going to have to be creative to bring this up, but I think it's very important so we can reverse these alarming statistics. So those 2030, what's going to happen? Let's hopefully 2030 gets here and it's not 40% of African Americans and Latinos. And, you may ask, well, how are we going to bring up those conversations?
Exactly.
And I just want to tell you, you have to think outside the box because every family is different. Some families, yes, you can just come straight forward, say, hey, I went to this awesome conversation about brain health. I want to tell y'all about it. Other families, they don't want to hear anything about it. And it's almost like talking about end of life, advanced directives. It's very similar to that in the Black community. And I want to tell you all, I had some friends come by and I say, let's play some cards. So in my family and friends, we like to play cards. And so, but they didn't know the cards was about advanced directives and what they wanted at the end of their life. And so that was my creative way to start having that conversation with them. And they didn't push back. Mm-hmm. I want to kind of share that for us to think about these creative ways because everybody really wants to know, but they just don't want to be open about it. And we know as the Black community, my family, what happens in this house stays in this house. Don't go tell nobody about this. But guess what, y'all? It's time for us to tell somebody. It's time for us to talk about this. So we all can be there to support each other. So we'll know what we can do to reduce our risk. So I'm not going to preach. I can tell I've been hanging with the pastors, right?
Yeah, I love that. And I was just thinking, gee, maybe after stuffing, we could tell everyone, in order for you to move on to the pie, you got to take the BrainGuide as a motivator. Make it somewhat competitive, but we'll see. So what I want to do now, I knew we were going to run out of time, but we've got some really great questions. If we could do some of these questions in sort of rapid fire to answer as much as we can, that'd be great. So we've got a couple people who want to know what kind of vitamins, because they see on TV prep, I'm not going to mention the ones, product, things that they could take to help their brain health. Any of those good or real, or are there other regular vitamins that people should look at to help keep their brain active?
Well, first of all, when you're doing a neurologic workup for vitamin deficiencies, we look for deficiencies in vitamin B as in boy, D as in David. Okay. If you have definitive B and D deficiencies, there are prescription strength medications to give you to replenish your supply of vitamins. Okay. Don't willy-nilly just say, take this stuff. If you have a true vitamin deficiency, there is a prescribed course of vitamin supplementation that you should take. Prevagen is something that we don't think is effective. They've got good marketing, but it is not something that is going to really help your brain.
And I know that some people believe more is better. So they'll be taking the vitamin D, they'll be taking their one a day, they're taking, they're lining up, not realizing that you might be taking too much of a good thing and that can actually harm you, right?
So ask your doctor to look for vitamin deficiencies to see what you really need to take rather than just buying some. Mm-hmm. As I said, in a neurologic evaluation, we're going to look at levels of vitamin B, vitamin D, and folate, and we measure that. And then if you are deficient, we replace it accordingly.
Do we know how much sleep is good for a person to take to have good brain health?
At least 8 hours.
Yes, it's 6 to 8. And so Stephanie, with the sleep thing, because I sleep now, but I didn't sleep before. So I just want to make sure people understand. Someone had to break it down to me because I was like, I have so much to do. I have kids, I have a life, I have a career. I can't sleep. And so they said, when you sleep, Aaron, your brain is flushing out all the tangles, all the plaques.
The amyloid gets rid of it.
Yep. But they had to break it down a little bit further, Dr. Parker. For me, I was like, okay, plaques and tangles. And that's one of the things that, when you hear Alzheimer's disease, that's what you'll hear. And so I was like, oh, okay. So I just wanted to kind of share that because when they broke it down to me like that, I was like, I do
Yeah.
need to get my sleep, because over time, if that's not happening, then
Right. It just
then
burns out. Yeah.
Well,
Is Alzheimer's hereditary?
Alzheimer's can be, yes. There are genes. There are 2 genes that we study pretty commonly. ApoE4 is one gene, but there are more than 30 different genes that are still being investigated that are associated with Alzheimer's disease. Now, just because you have those genetics doesn't mean that it automatically turns on that Alzheimer's cascade. Dr. Griffith, who's a neurologist here in Atlanta, worked with a study that found a gene called the ABCA7 gene, which is common in African Americans.
Yes.
And that gene turns on in the presence of poorly controlled hypertension.
Okay. I love Patrick. He's a fantastic doctor and learned so much from him. It's amazing how people like you all, you get into this field. It's the passion and the learning, and the more you learn, the deeper it is, that you stay in it for many years. And so we owe you all just a great debt of gratitude in helping us peel back these layers and these onions. That is Alzheimer's and cognitive impairment. Unfortunately, we are almost at time. I try to cover most of the questions that were put up in the chat. But again, BrainGuide is really a really important tool that people can take advantage of today. It's something that we haven't had access to before. It's not as subjective as some of the others. I think the other things that are out there, it's scientifically validated. It's been tested on people who are a variety of colors and genetics and things like that. And we know that it can be helpful. And again, it's a tool that you can take to your doctor to really begin that conversation. So that's so important. So I'd like to just thank, and I hope we all will take time to thank Dr. Parker, Dr. Epps, for joining us today, but also for being leaders in the community that you are, being wonderful scientists, asking those tough questions, demanding that we address this health disparity, and helping us put the information in the hands of people so they can really take action on it. So thank you so much for joining us. We really appreciate it.
Thanks for the invitation.
Yes, definitely. And thank you, Stephanie. You've done a fabulous job moderating, and the conversation just flowed. I was like, wow, there's so many takeaways I have from this session. The one that I really love was with Dr. Epps saying everyone wants to know, but they don't want to talk about it. And so we have to keep that in mind as we move forward. I'd like to thank everyone for attending. Sadly, we're out of time, but one of the things that we will be doing is sharing the remaining questions via email in terms of providing you with some answers. And we also will be sharing the resources that you see here on the screen, along with a video of today's presentation for all those that registered. So again, we'd like to thank all of our speakers for sharing their expertise. We hope this conversation has given you new knowledge, new resources, new strategies to embrace brain health for yourself, your network, and your neighborhood, because we can each be a catalyst for change in our own community. So let's get started making those simple everyday changes to reduce our own risks, like getting regular exercise, all the things that we know. It also means starting the conversation with a loved one with signs of changes to their memory. So really it means talking to your doctor at the end of the day, because it's never too early or too late. And then engaging and spreading the word wherever and however you meet your friends, family, colleagues, your church community. There's a potential opportunity to start talking about it, as they mentioned, during the holidays. So the holidays are coming up. I need that card game with my family as well. So it's all about giving the people we love the knowledge they need to stay healthy, know the signs, and get help if they need it. By taking those simple steps, we can ignite meaningful change in Black communities across the country. Thank you all again for being with us today. We look forward to working with you in this growing movement for brain health equity. And good night.
Are you worried about your memory and brain health? Do you have concerns about a loved one? Us Against Alzheimer's can help. BrainGuide is a free platform that provides you with knowledge and resources to take the best next steps in managing your own or a loved one's brain health. BrainGuide includes confidential memory questionnaires that can be taken over the phone or online in English or Spanish. If you have memory concerns for yourself or are noticing changes to your thinking or memory, you can take a self-administered questionnaire. If you have concerns about a loved one's memory, you can take a questionnaire for someone in your life that you see often. When you are done, we will send you tailored resources based on the answers you gave us. And you have the option to print a summary for your doctor. BrainGuide is not intended to diagnose or make treatment recommendations regarding Alzheimer's or any other disease. First steps can be tough, but just one small step now can help you take every step that follows with confidence. Visit mybrainguide.org or call 855-BRAIN-411 to learn more.